Group, and the topic of our presentation today is irregular mass at third eyelid in a 5-year-old cow. Let me introduce the patient details. Her name is Tang Tai, a female crossbred Holstein Friesian. She is 5 years old, weighs 500 kilograms, and has a body condition score of 2.75 out of 5 with days in use of 60 days. Sheep complaint. The owner noticed a mass on the right eye. Initially, the right eye appeared red since the purchase, and over time, the redness progressed into a palpable mass that grew larger. Previous medication. The owner has irrigated the eye with normal saline and applied terramycin ointment once daily for about 10 days and dropped Oxytec TP for another 4 to 5 days. But since there was no improvement, all the treatments were discontinued for a few days before our farm visit. History taking. For feed and water, Tang Tai has at libitum access to raw fish, including napier grass, cassava pulp, and blended corn husk. 3 kilograms of concentrate per day, and fresh water is also provided at libitum. She has normal appetite, water intake, urination, and defecation. Since her purchase, she has not received any vaccination and deworming treatments. Currently, she is producing approximately 20 liters of milk per day. For physical examination, most of the vital signs were within normal range, except for the heart rate and respiratory rate were elevated, indicating tachycardia and tachypnea. We observed an irregular mass measuring approximately 3 by 4 centimeters located on the right third eyelid. The mass progressively enlarged compared with the previous video. In addition, right unilateral mucopurulent ocular discharge was also observed. Initial problem list. The specific signs include an irregular mass on the right third eyelid and right unilateral mucopurulent ocular discharge, while the non-specific signs were tachycardia and tachypnea. For the initial assessment of the irregular mass on the right third eyelid, the possible causes can be divided into neoplastic and non-neoplastic origins. From neoplastic, the differential diagnosis include epithelial tumors, mesenchymal tumors, or round cell tumors. And from non-neoplastic causes include inflammation or abnormal growth. The next problem is the right unilateral mucopurulent ocular discharge. It can be divided into infectious and non-infectious causes. Infectious causes include bacteria, viruses, and parasites. Non-infectious causes include increased tear production due to pain or irritation, and abnormal nasolacrimal drainage, either from intraluminal obstruction or extraluminal space occupied.
In the initial plan, collect blood for CBC and serum chemistry for a preliminary health check and to evaluate indicator of infection, inflammation, or cancer, and perform PCR from blood to detect bovine leukemia virus, the causative agent of bovine leukosis, since Tang Tai show clinical signs resembling the disease. And do the surgically remove the mass at the right eye, then submit the excess mass for the histopathology examination. From the CBC and serum chemistry result, the overall is normal. However, there are leukocytosis and lymphocytosis and hyperfibrinogenemia. The serum chemistry showed GGT level were slightly elevated. This is a summary of the blood result. Next is the detection of bovine leukemia virus by PCR. The result was negative. Next is the surgical procedure of the removal of the mass. The surgery was performed under standing sedation. We used salicylate hydrochloride at the dose of 0.02 mg per kilogram root IM for the sedation. During the procedure, lidocaine was administered 3 times. First, for the auricular papillary nerve block dose 0.2 mg per kilogram 5 ml, and topical anesthesia dose 0.12 mg per kilogram 3 ml. Then local infiltration into the mass dose 0.2 mg per kilogram 5 ml. And we start the procedure. We start with auricular papillary nerve block with 5 ml of lidocaine at the highest point of the bone ridge of the zygomatic arch. Then We apply 3 ml of lidocaine to the eye for topical anesthesia, then infiltrated 5 ml into the mass using a fan-shaped injection technique. After that, we wait for 3 to 5 minutes for the lidocaine to take full effect. Then we check the numbness by gently poking the blocked area with the blunt needle. Once adequate anesthesia was confirmed, an artery forceps was placed at the base of the mass before excision. The mass at third eyelid were carefully excised with manual scissors close to the base, as you can see in the video. Hemostasis was achieved by applying gauze compression until bleeding stopped. The eye was flooded with 0.3% diluted povidone iodide followed by saline irrigation. The excised mass had irregular and lobulated shape with a dark red coloration, soft to firm tissue mass measuring 4.7 by 2.3 cm. It was submitted for the histopathological examination. Post-operative medication consists of funicimecumine dose 2 mg per kilogram intramuscularly, ceftiofur hydrochloride dose 2 mg per kilogram intramuscularly, and topical application with terramycin ophthalmic ointment.
For post-operative care, for the eye with normal steroid 30 ml, apply terramycin ointment, administer funicimecumine and ceftiofur hydrochloride dose 2 mg per kilogram used intramuscular. All steps were performed once daily for 4 days. Possible complications after mass removal are orbital fat collapse, hemorrhage, keratoconjunctivitis, scar, superficial keratitis, entropion, conjunctivitis, and infections. For post-operative follow-up, the first picture was taken immediately after surgery. After a few post-surgical follow-up, no sign of inflammation or infection were observed around the right eye. The owner reports successful administration of injectable medication, but did not perform eye irritation or apply the anti-rheumatic ointments. For the histopathological examination, the small image showed the normal epithelium, while the bigger image showed the abnormal epithelium lining. In the thickened epithelium area, penetrate the basement membrane and invade the underlying submucosa. This encapsulated neoplasm composed of anatomosing cord, trabeculae, and nest of polygonal cells. Neoplastic cells have indistinct cell border with small to moderate amounts of homogeneous to biligranular eosinophilic cytoplasm. Nucleus are large, round to oval, with fiery staple chromatin and 1 to 2 prominent round nuclei. There is moderate anisopsis and anisopyrosis. Magnetic figure range from 0 to 4 per high profile. There are multiple cooperative characterized by fiery eosinophilic central accumulation of compact lamination of keratin. There are perivascular lymphocyte and plasma cell infiltration. Also, lymphovascular invade of neoplastic emboli is suspected, which is diagnosed as squamous cell carcinoma, suspected metastasis. For the revised assessment, irregular mass on the right third eyelid was confirmed as the epithelial tumor based on histopathological ruling out other causes. Like unilateral microcurrent ocular discharge was unlikely to be infectious as supported by blood test results. A non-infectious cause was considered more likely with squamous cell carcinoma favor as the underlying reason, both by increased tear production and obstructed tear draining. And the prognosis for this case is poor.
Further discussion. Some mass and fat at third eyelid can be caused by squamous cell carcinoma, which is the most common tumor in this area, as well as papilloma, liposarcoma, angiosarcoma, and melanoma. This paper is a retrospective study of 186 tumor in bacillary cattle, which found 88 cases of tumor of the eye and periorbital tissue. One of these was a papilloma, but all of the remainder were squamous cell carcinoma. Next, let's take a look at squamous cell carcinoma, which is the most common type of tumor found in the third eyelid in cattle. Squamous cell carcinoma has several contributing factors, including breed predisposition, especially in white-faced cattle like foresight vision. In addition, prolonged exposure to ultraviolet light is a significant risk factor, and this tumor most commonly appears in middle-aged adults. Squamous cell carcinoma is a locally invasive tumor with a likelihood of metastasis estimated at around 11%, and definitive diagnosis can only be confirmed through histopathology examination. For the gauze lesion, the tumor is classically pink, red, or ulcerated, cobblestone in appearance, while microscopic lesion form neoplastic cells that commonly form concentric laminated mass of keratin folds. For the treatment, surgical excision, which is used in this case, is the most common option for tumors located at medial canvas, but there are other treatments available as well, including cryosurgery, which is used for small superficial lesions with fewer complications, but it's not appropriate for large mass. Enucleation or exenteration offers a definitive control for extensive disease, but it's a major costly procedure and results in loss of the eye. Radiation, particularly beta radiation, allows preservation of the growth and its effective in case of incomplete excision or squamous cell carcinoma, but it's expensive and not widely available. Adjunct therapy such as chemotherapy or immunotherapy can be applied topically or intralesionally, offering a non-surgical alternative, though their efficacy varies and there may be withdrawal concern. Finally, radiofrequency hyperthermia use local tissue heating or ablation, causing minimal damage to surrounding tissue, but it's unsuitable for large lesions and has limited availability with variable success rate. And the recurrent Alzheimer's cell carcinoma is approximately about 40 to 50%. These are our members, and thank you to our advisor for their guidance.
อ๋อจะยัง